Perfect. Yeah. It'll be kind of, at least this is like to give you guys a brief overview. And then the easiest way to learn is to obviously be doing it yourself too. So at least I want these to be like familiar icons and buttons and stuff for you to push when you do eventually start your rotations. Okay, so you guys can all see what I see. So we have to do this all in a test patient too. And so a lot of the tabs that I'm going to show you won't have like data in it for it to really make the most sense. But I did want to kind of show you like how I would set up my bars and things like that. So are you guys all familiar with Epic? Have you been on Epic before? Somewhat, okay. And so when you first, and I wish this would go down a little bit, but when you first open, you'll obviously have your patient name, top left-hand corner, gender, age, date of birth. You'll also have their MRN, and then in terms of the admit, it'll say like the specific date they were admitted. So a lot of times patients will transfer services. So even if you get like a new patient on your list, they might have been admitted like 7 days ago. So it's always helpful to look at the admit date to see if they're new to the hospital or just new to you. And then the unit will give you their specific room number. This is really helpful when you are doing things like discharge counseling and med history. So that'll be your friend. You'll be able to see if they've had a transplant, and if they have, you can click on it specifically and see like what year, what specific organ it was, what specific organ they received. And then really helpful for you guys, they'll have their weight as well as their height. So always use, and then you can hover over it to see when it was most recently updated. And so you always want to make sure you're using like an updated, specifically weight when you're doing like calculations like creatinine clearance and things like that. So that'll always be one of the first questions your preceptors will ask you is what's their creatinine clearance, because they will give you a number up here in the top. Do you see where my mouse is? In the upper right-hand corner, sometimes that's not always correct. They don't use the correct weight. So I would always just calculate it yourself, at least for the first couple of ones, just to make sure that they match.
There are medical center policies related to how frequently people get weighed.
Okay, I wasn't aware.
So pediatrics is much more frequently than adults, but there are also certain populations that have fluctuations in weight.
Yeah.
For example, what you guys think about raising muscular status or patient populations that are at higher risk? Or maybe like fluid status and weight would be a big issue. Fertility. Yeah, like cardiology.
Heart failure, and then I'm on my transplant rotation right now, and since they're getting like new kidneys and fluid status is really important for them too, we get daily weights on them as well. So the weight does definitely fluctuate, and differences of even like 2 kilos over 1 day is a big deal. Allergies, this will probably be something that you'll be able to update to in your med histories, but always write down the allergies when you're doing your med history, so that way you can either remove certain allergies, add to certain allergies, or even add new ones. And this includes both food and over-the-counter and prescription drugs. So always ask them about OTCs too.
It shows you what the issue is.
Yeah, and so we can
like legit or not.
even specifically click, yeah, you can specifically click into it and see what specific one. So we'd probably want to avoid giving amoxicillin to this patient considering they had angioedema, but things like a rash, that might be something that you could just go in and clarify to see like if Cipro was our #1 treatment option for this patient. Peanut oil and things like that. Every time you do click into this tab, it will say like, would you like to mark this as reviewed? And so if you haven't spoken to the patient, if you're just more curious and clicking on it, you can go all the way to the right, and I think it just says not now or save for later or something like that. Do that, because you never want your name to say marked as reviewed if you've never actually really spoken to the patient yet. And then up here, it'll have the attending provider. So just knowing who the main attending is on your team, the providing team. So if they're on transplant, it would have transplant as the providing team. The primary RN, which is really nice. So that way, if you just wanted to have the nurse ask a patient a question, if you don't necessarily need to page the team, but you just need to see, hey, do they have this home med with them? The nurse is a really good resource for that too. And then you can see their PCP. And then coverage is sometimes really helpful for us specifically. So a lot of our patients need financial screening. And so you can see if they have like I think it's an S or a P next to their, S or a P next to their name. That means they're either getting financially screened or that they need to be financially screened. If they have a V next to their name, that means they're verified. And so patients that are 1V will get all of their medications at no charge from UVA. So this can kind of help you if they're picking random antibiotics and you see that they're 4V, which is a lower standing, the patient's going to have more out-of-pocket costs. And so that would just be a consideration to have. So that's like basically the whole top banner that you can just use to get like a quick brief overview for the patient. Oh, okay, so this is where the allergy thing will come up. So unless I've talked to the patient, I just hit not now, and then my name doesn't go on it. So the snapshot is the next the first tab that'll really be your friend, and this is how the tab that you can kind of cater to how you want to work up your patient. And so let me just add, I can kind of show you how you would add your preceptors on the first day. I know Jillian on my internal med rotation basically set me up with how she does hers too. So I've always just kept hers. But you'll go to this little wrench thing. And so right now we have the glucose accord, the RX summary. Another one that is I'll just start adding them and then we can kind of go through each one. But discharge. I don't know if it'll be discharge meds. I don't know if this will let me pull in all the specific.
It's not a real patient.
It's not a real patient, yeah.
We can't do a real patient.
I know, yeah. It'd be very nice to show you some of my, so 14-day micro is definitely one that you want to wrench in. Anticoag. And then I'll go through what you can find in each of these. Red, pain, RX MedRec. Blood, Springboard, and all right, so we'll just have these for now. So this adult primary snapshot, this is where you can just kind of find basic patient info if you want to know where they are living or like where they're from, if they're local or if they're from a couple hours away. You can always look at their address. It'll also give you their health maintenance. So a lot of times, a lot of your preceptors will be like, well, did they get their flu shot this year? Are they due for, their Prevnar or anything like that? So you can see anything that has been recorded in our system on this page. You can see, let me scroll down. Yeah, any immunizations. You can look at their social history. So knowing if they smoke, if they drink is always very helpful. Again, their allergies are on here as well. If they have any implanted devices, this will be listed on here. And then that's kind of all I really use this page for, is mainly just the demographics and the social history component. Yeah, the 12-year-old boy. Yeah, so that's how you know. I do. It is very much so a test patient that is on norepi and milrinone. So, all right. So that is the adult primary snapshot. I think most people always keep that as like their first tab. Glucose accord is really, really helpful if you have a diabetic patient. And so it'll basically give you, and you can do it as like a 1 hour view, a 2 hour view, all the way up to a day. And it basically shows you every recorded blood glucose for the patient. And then in another row below, it'll show you exactly what doses of insulin were administered. So you'll be able to see like if they got insulin regular, insulin Lispro, their Lantus, and then you can kind of trend and watch like, oh, they got 30 units of Lantus at this time, and now their fasting blood sugar is less than 100. So you can kind of see what it looks like over the course. So this is definitely a tab that I use all the time. RX summary. I don't believe I use that tab at all. 14-day micro is really, really helpful. So this only gives you the micro results from the past 14 days, as the name might suggest, but it'll basically show you when cultures were drawn, and then as the results come back, so it'll then report gram-negative rods, and then maybe 12 hours later, it'll report specifically what those gram-negative rods are. So I would think like gram-negative rods, Pseudomonas, and then eventually it'll say culture and process, and then once the culture is done, you'll be able to see the susceptibilities. And so this is a tab that you're going to just have to kind of keep refreshing throughout the day to see what results come back in. If you're curious, say you know that the patient in the past has a history of, resistant bacteria, you would go into this tab here, results review, and you'd go to it'd be under micro in this section. So this would allow you to scroll back past 14 days. And it's kind of hard to show you everything just because this is a test patient, but if you wanted to see any kind of culture results from the past hospitalizations, this is where you would go to look. And then anticoagulation. So this one is really, really helpful if you have a patient on a heparin drip, a patient on warfarin, a patient on apixaban. And so it will report their INR, their hemoglobin, their hematocrit, and their platelets. And so, typically in the hospital, we'll hold Vte Prophylaxis with our heparin if their platelets are less than 50. And so you can see like, hey, their platelets are 35 and they've been receiving heparin. Maybe this could be an intervention that I would want to bring up with the team. And so again, since our patient in this demo is not on any sort of thing, but it would, whatever dose and whatever medication they were getting would come in this bottom row right here. So you can see exactly what they're getting. For heparin specifically, we monitor anti-10A levels. And so if your patient's on a heparin drip, your preceptor will always want to know, well, are they therapeutic on their heparin drip? And so this is where you could find their anti-10A levels too. I included RAD here. So this is any kind of radiology results. So ultrasounds, chest x-rays, MRIs. And I know it's not our job to read or interpret them, but a lot of times if a patient has pneumonia, they'll get a chest x-ray and you can see if there's like these ground glass opacities in their lung, which might give you an indication that, hey, the team is probably going to talk about starting them on treatment for their pneumonia today. So that's basically what I use that for.
That's not to go down the rabbit hole.
Yeah, that is if I even click on that tab. Yeah, so that is more just like for your reference, but I do always have that one wrenched in. Pain. So this one isn't one that I use all that often, but it will give you a report of all the pain medications that the patient's on when they're receiving them. It'll also, in this like a row below, give you their pain rating. And so if you can see like the patient's pain rating is consistently an 8 out of 10, this might be an indication for you to bring up with the team like, hey, do we want to go up on, schedule their Tylenol as opposed to keeping it PRN or something like that. So that's, I think, the only reason why I would use this tab. Insert, yeah, especially like maybe in your post-surgical populations and things like that. A good thing that they do include in this is their respiratory rate. So obviously if a patient's getting over-sedated from their opioids, you would not want to recommend increasing their oxycodone or anything like that. The next one I have, so this is something that you guys will probably be tasked with doing a lot of. So definitely wrench this one in. It's their RX MedRec at admission. And so typically, even on my transplant rotation right now, we print out the new ones from every morning. And basically you'll be going to patients' rooms. They have their name and their MRN. There is no room number listed on this, so that's always something that you want to write down on the page. And then the listed allergies that we have. So typically when I go and do my MedRecs, I obviously verify it's the right patient, name and date of birth, and then I'll start with the allergies. We'll print these out so you can just write right next to them like allergies up to date, and then going through each and every medication. I know there is. This patient is on some random things, but they're always going to want to make sure, I'm sure you guys are very aware of how to do MedRecs, but here we get very specific because basically the MedRec that you get, a pharmacist will sign off and put their name on it. So we always we're trusting you to do it, so it needs to be accurate. And so always just clarifying the name, the strength, and then the specific sig. So if the patient says, hey, I actually I take 3 puffs every 4 hours as needed, that's a discrepancy that you would want to note for the pharmacist. And then you obviously mark it taking or not taking, and then any specific comments, like the patient reported that they were running out of their albuterol and it's going to need a refill at discharge. That's something that, you know, the team might never pick up on, but since you specifically talked to them, that you would want to bring up prior to discharge. So
when you can also come up with clinical recommendations, if indeed they were using far more albuterol.
Exactly. Yeah.
There's probably another drug that needs to be added on if our rescue.
Right, is our main state of therapy. So yeah, there is a lot of good interventions that have come from some of my med recs. So don't never underestimate a good med rec. Blood transfusions. So this is going to be more for your ICU rotations. And so this one will tell you how many units of like FFP, cryo, precipitate, red blood cells, platelets they've been getting. And so obviously it's not for you to recommend that they need additional blood support, but just to be able to notice and recognize that your patients are requiring transfusions, you know, daily or what have you. This could also suggest possible like anemia, or are they bleeding from somewhere that we don't know about and stuff like that. So I use this one only on my ICU rotations. Springboard Report. Are any of you guys doing any oncology rotations? So the Springboard Report is specific for your oncology drugs. And so this will give you like specifically what chemo regimen they're on. It'll also talk about what regimens they've tried in the past. You're not going to be responsible for like releasing the chemo or anything like that, but I think it is helpful to recognize like what drugs they're on and then the possible side effects for each one that they might be. And if they're inpatient, you'd want to know like, hey, they're going to miss their, you know, next dose of Cyborg-D, like making sure the preceptor is aware that, do we want to give it inpatient or are we just going to defer until outpatient? So you'll only really use this one if you are in oncology. And then another useful one, so just going to the wrench, is MAR administrations. And so this one will show you basically, since this is a fake patient, it'll show you it'll first group it by active meds. So you'll see any active meds, like when they received it, like what the dose was, etc. And then it'll show you discontinued meds, so meds that they might have gotten that morning but are no longer active on the MAR. And so this is just another way to see like exactly what the patient is getting inpatient.
Medication administration
Record.
I mean, that's like your best friend with the patient settings. You know when they got things, what doses.
What doses.
If something was late, if you're doing kinetics, and the dose was all the wrong time, you've got to do different work. So
Yeah.
It is your best friend.
It.
Your preceptors will expect you to know when the doses are.
Yeah.
What's the difference of looking at the MAR administrations as opposed to the MAR tab?
So this the MAR tab, I think is not here. I know, so the one on this that typically it will appear on this side is more the nursing MAR, and so it'll appear like little blue bars that go across. It's very wordy and very difficult to read. I don't look at that one specifically, so I always go for the one up top. And then I believe the Rx summary will also give you a different view than the MAR tab of what specific drugs they're on, and I'm almost positive that I use more of the Rx summary than of the MAR. But I think the good thing is there's multiple different ways to see like what your patients are getting. Another way to see what they are prescribed inpatient is to look through this history. Most pharmacists actually use this tab when they're working up their patients. I haven't graduated. Exactly. It can get very confusing. The only reason I use this specific tab is say the patient has this amoxicillin allergy listed, say it was a rash. I'm working in the hospital basement and I want to see, have they ever gotten amoxicillin in the past? You can click on this history tab and this will show you any medication the patient's ever received through UVA. And then you can specifically filter. And so I can filter and see, like, let's see. Come on. And then it would show you if they had received it, there would be a little like person with a check mark next to it. So that would be an indication that, hey, this allergy is listed, but I think it would probably be safe to give this drug to this person. So I think this tab is just helpful to see, like, especially when you're trying to pick Vanco doses for a patient that might be obese or stuff like that, you can see what they've ever gotten in the past here to kind of help guide your clinical recommendations. And so this tab is really nice just to be able to sort. You can sort by pharmaceutical class, so you could sort the drugs by specifically antifungal agents, their antihypertensives, etc. Any questions about this stuff?
I just want to make one note about the RX MedRec at admission.
Yeah.
So that's just it's just a form to print out. Write on. Where you would actually go to make the changes is the home meds
tab, and then you would
taking or not taking.
Yep, and then your specific notes, and then you would then be putting a note in as well saying, I made XYZ changes. We like to track the number of changes, so you would report, like, I reported 6 discrepancies on the med list, and then list them out specifically. So we like to track numbers and justify it. The next tab, so this is Snapshot. This is basically just where you can wrench in all your tabs. And the next tab is Chart Review. So in Chart Review, you can see different encounters. And the encounters basically will just give you this big overview of their appointments, their admission histories, etc. So I always just use this tab to see, like, if they're trying to discharge a patient, and obviously it's not my responsibility to make sure that they have the right appointment set up, but if they're worried about their diabetes, I can see, like, hey, they're going to have an appointment in 2 weeks with their diabetes educator. So you can just really see what appointments are planned in advance for the patient. Labs is another, so there you can look at lab results via this Labs tab or via Results Review. 9 times out of 10, I'm using Results Review for my labs. The only time I'll use this section is if I'm waiting on a Vanc random or a Vanc trough to come back. You can see here, it'll like list what the status is of it. So sometimes you can see like active not drawn, active in process. And so it at least gives me an indication that yes, we're doing something, but it's just not back yet. So that's the only real reason why I would use this Labs tab. Imaging is another way to look at the rad wrench-in that I've already showed you guys. So I really don't use that. Surgeries, I don't use that. Anesthesia, this one is actually very helpful if they have any sort of surgical procedure. A lot of times they're getting antibiotics in the OR. And so if you click on this anesthesia tab, it'll have like the anesthesia report, and it'll have every single med that was given. I think the most helpful way, you can always scroll through it, but you can always click into it and Control F and search. So I would search Vanco, Cefazolin, Unison, any particular drug. And so this is really helpful when a new order from, like, for Vanc comes through, but you just want to make sure that the patient hasn't received any intraoperatively before you give them their next dose. I don't really use procedures. Yeah. Yeah.
It's interesting nonetheless.
Yeah.
But just don't find yourself too far down the rabbit hole.
No, I agree. So EKGs, we don't read them, but what's the one thing that we do worry about from them? Yeah, so we always look at the QTC. And if I ever have an issue with something like that, I'll page the team. And granted, like, if certain heart rhythms can cause certain QTCs to appear more prolonged when they're not actually. So I always kind of preface it like, hey, I noticed that their QTC is 505. Do you think it's actually 505? And if so, they're on trazodone, an antipsychotic, and something else. Can we maybe try and limit, the PRN, Zofrans that we're giving them or stuff like that. So that's really the only thing. And to view the EKG, you would click on the EKG, and then it'll have when you're actually in the a real patient, it'll have view waveform. So you would click view waveform and then zoom in to the top left-hand corner and it would report the QTC. Meds. This is actually really, really helpful to see what meds have been sent over for discharge. And so to do that, you're going to sort by ambulatory care, and then a box would pop up where you could load all records, and it would show you the date it was prescribed. And so you can see like, hey, the team said that they were going to send over oxycodone for discharge. Have they done that yet? And you could see what the prices are for each drug, which is always a contention point at discharge. We try and push them out the door, but then don't realize that certain drugs cost a certain amount. So to see that, let's see if it'll give us any indication. Yeah, so you would click on the drug, and then you can scroll down, and then you can see that it was sent over and that the patient charge would be $60.70. And sometimes, and then you'd be able to see like they canceled the fill. That could have been because of charge or like the cost or anything like that. So I just think that this is a helpful tab just to see the cost of each med. And then I don't use episodes. No. Yeah. And then I'm like, well, let me look at it. I don't. Notes. This is another way to get to the notes. I typically go, there should be a notes tab too, but I don't necessarily see that. And then all of these, this one is, hold on. Let me add, see if something comes up for this. LDAs, so I don't know what it's, lines, drains, and thank you. So this will tell you the kind of access that the patient has. So do they have a central line? Do they have a peripheral line? Do they have an NG tube, an OG tube, a J tube? And so this is really helpful when you're trying to pick the route of administration. A lot of times, especially if you're on your, does anyone have a benign heme rotation? So this one is really important for benign heme, which I just got off of, because a lot of the DOACs are absorbed in different parts of the stomach. And so if a patient has a tube that ends in their small intestine, but the drug is primarily absorbed in their stomach, you would want to know what kind of access they have before you would recommend a specific thing. And then for central lines, it's always helpful to know, because this allows you to administer more, like if they need potassium supplementation, you could administer more through a central line than through a peripheral line. So that is helpful. But then everything else in this tab, I don't use. Review flows. I think that this is something that you use sometimes more in the outpatient setting. I don't use it at all inpatient, so I typically skip over that one. And then results review. This is just another way, this is the way that I look at all my labs. And so say you wanted to see if there was a trend in their white blood cell, like their white blood cell count's 2 right now. That's pretty low, but let's see. Flow sheet. So if you highlight specifically to make it blue, so just clicking on it, and then you do flow sheet, it'll give you a straight column of every value that they have in EPIC. So you could see like, hey, they've had a trend in their INR that's always been between 2 and 3. But this is really helpful for finding specific trends. So trends in platelets, trends in white blood cells. That's typically the trends that I try and follow there. Let me see if there's, this is also where if you type in, so there's no bank, but this is where I would search for my bank randoms and my bank troughs. And then it's always important once you get your banks to write down, you know, the date that it was drawn, the time that it was drawn, what the level was, and then look at the banks and see when the last dose was. So that way you can start doing your kinetics with that. Your preceptors will give you plenty of practice with bank, and I'm still getting a lot of practice too. Allergies. This is just another way to get to it. You can also get to it up here too. History. This is I think this is more so used as well in the outpatient setting too, but this is another way to look at what their family history is, what their socioeconomic status is. I know substances, this is where you would input like how many cigarettes they smoke per day. I don't use the problem list ever. And then demographics. This is helpful. I know, at least on the one inpatient, you can see what their primary language is on here. And so sometimes it's helpful to know prior to going in to do a med rec, is this a Spanish-speaking patient, and do I need to get some sort of either interpreter or they have these blue phones that have automatic interpreters on them. So that's the only reason why I would use a demographics tab. I don't use letters. I don't use print form. FYI, I don't use. And then the meds tab, again, is just another way to look at what agents they're on inpatient and just make sure you're always on current. So when I typically work up my patients in the morning, I always go right to, they also have results too. I wrench in my results to this first snapshot page, but I'll always click on the meds to like see if anything has fallen off, changed, and then I'll look at results and see like, are my meds impacting any of these results? For my transplant rotation, there's a lot of meds that can cause like decreases in white blood cell counts, so I always write down the white blood cell count, see if any med has changed from the day before, and if I have any like recommendations. And then those are really my two go-to sections. And then there's typically a notes tab here. And if I find it necessary or if I have time, I'll click on the most recent note just to give myself a brief overview of what the patient is here for. But really focusing on the meds, every preceptor is going to want to know, yes, the dose might be right, but is the patient indicated for it? So just always know the mechanism of action. That's bitten me in the butt a couple of times too. So just making sure that you are aware of every medication on their med list, and then looking at their results, and then I'll click on 14-day micro if they're on any sort of antibiotics. And so that's kind of like my quick approach. And then I think it doesn't have this. Let me see if this is it. No. Want to do that. There should be a tab on the side here that also allows you to update the Rx Handoff. And so this is a way some pharmacists will work up their patients, is in this little sidebar. It's not on this particular test patient, unfortunately, but you are able to basically pull up and kind of write your own little handoffs to yourself as opposed to writing them down. So sometimes your preceptors, I know I've seen a lot of students' notes on the sidebars too. So I think that they do give you access to those and allow you to update your recommendations there too. Yeah.
So where do you find what the drug is being used for if you don't look at the problem list?
So I think you can look at, so the problem list, I guess, would be helpful in that sense. I think if you need to, you can look at like the first note for why the patient's in and kind of knowing the indication for the drug, kind of tying 2 to 2 together. If there really is no correlation, like this patient's on, let me think, some sort of, we'll just say like doxycycline, some sort of antibiotic, but has no history of Lyme disease, like there's no indication, then that would be something that I would write down in like my little handoff to follow up on, like indication for antibiotic ? And then that would be something that I would follow up on rounds. But I think a lot of times you can get the quick set of problems because in the notes they'll basically say like, CM is a 48-year-old female with a past medical history of XYZ who presents with this. And so knowing their chief complaint and what they think is their past medical history is how I would do it. Because a lot of times this problem list isn't always the most up to date either. So. No, in theory. I know, yeah, because a lot of times they'll just quick reorder things before we even go through and do like the med rec too. So it can get a little messy, and there are times where a med is ordered and there's not a specific indication, and that's kind of where we come into play. So I know even today there was fluconazole on, I didn't see a specific indication for it, and you question it, and it came from an order set that was a post-op order set, so the patient wasn't even supposed to be on it. So there are like a lot of things that, but I wouldn't overthink it too much. I would notice it, recognize it, write it down, and then keep going through your workup, because you can probably go down rabbit holes trying to figure out why they are on something when it might not be that ultra important. It's for our transplant patients. They're on it for like 30 days as prophylaxis, but it doesn't have to be given IV. So, yeah.
If you click on the medication, like, I don't know about this patient, but I think if you click on the medication, sometimes it'll show associated diagnoses. Just so everybody knows, if you go into the medication tab and sometimes click on the medication, it'll list associated diagnoses.
I know for certain, like specifically for our antibiotics, a lot of times if you like order vancomycin, it'll make you make the provider specifically pick an indication, but sometimes they're just flying through it where the indication that they pick isn't always right. So they'll put skin and soft tissue infection when it's really pneumonia or something like that. But they do, some of those meds will have like for pneumonia or something like that. So that is helpful too. Don't trust it, but take it with a grain of salt. Any?
Like,
yeah.
Maybe go to the internet, like UVA webpage,
yeah.
and like where some of the guidelines are, and
yes.
Help everybody out.
So we need. So knowledge link, this will typically pull up when you first log into your computer. This is going to be one of your best friends. And so you can get to your email through knowledge link. And then you can also get to UpToDate directly through knowledge link, which is always very helpful. You can get to Lexicomp as well as PubMed. So those are probably the 4 things I use this initial tab for.
And then Lexicomp, where you can find.
Yeah. Let me think of it. So you would be able to get that here. Or I know like something like meropenem, it's restricted here. So that would give you an indication that ID is probably involved and was giving you AST approval to use that drug. I'm trying to think of, bisoprolol. So bisoprolol, they don't have that here. So that would be something that you would have to find an alternative for. And I encountered that this past weekend. So there's conversions between the different agents that you can Google. All right, anything else from Lexicomp? And then, so on the intranet, if you go to Clinician Portal and then go to View Clinician Portal, and then you want, it looks so different here, Pharmacy Services under Lab and Pharmacy, Pharmacy Intranet. It's a very convoluted way. But then the main one that I typically use is Anticoagulation over here on the right-hand side. And so this one, you have to do multiple different clicks, but then it'll give you adult guidelines. And so this is really helpful for, let's just go through, say our patient's on a heparin drip and we're not really familiar with it. We use a heparin nomogram, and so you can click that. And it'll kind of detail out specifically like what the order is supposed to look like. So based on the patient's weight, they would get, if they're on a standard nomogram, they'd get an initial 80 unit bolus followed by 18 units per kilo. And then it'll show you how the nurses are correcting based on the 10A level that they get. And so this one, if you have any patients on heparin, would be a very useful document just to print out and keep in your manila folder or whatever you decide to use as a way to keep track of things. Another common one that I use from this, let's see if it lets me go back, is our Vte Prophylaxis, because that's another question that you'll always get. Yeah, so this guideline is really, really helpful. And it basically shows you what to give based on the patient's weight. So if a patient's less than 45 kilos, if you see 5,000 units, like heparin 5,000 units Q12, typically that would be a red flag, like, hey, this patient's being underdosed, but you know based on their weight that they should only be getting it Q12. And it does for the different weights here. That's what I really use this for. Another thing that you can get on this, so if you go to Alpha Index, this has just different random documents for just any drug you could think of. So we have like our clozapine REMS program policy here. A lot of times if you're just unsure of something, you can always search the Alpha Index first to see if it's on there before you ask any kind of questions. I know I'm working on updating the Novo 7 guidelines, so if for whatever reason you have a patient on that, this is where you would find the guidelines. And I do know, like, if you have a patient going through alcohol withdrawal, I've used this document. Hold on. Excellent. Yeah, I think I've gotten to it through this main thing. Yeah, so you can Google that and it'll show you, like, I don't know if you're wondering why a patient has Ativan ordered every 1 hour for a CWAS score greater than 8, this will give you like the exact protocol that they're probably using. So a lot of these I'll print out, you know, like even on my transplant rotation, I have a little manila folder and I'll just keep all the guidelines that I think I might need for that specific rotation in that folder. So that way I always have them on hand. Or you can keep them on your computer. Trying to think of what else I use that.
That actual, like, all this content, I really good with that. I think there's 60 or 80 different things. Like, there's albumin heavily restricted. Remember
Yeah.
there was that case that when it presented in about that.
So yeah, I think if you need anything there, it's probably somewhere on the Alpha Index. Sometimes it's just a matter of finding out exactly what to search for or the specific name, but the Alpha Index is definitely useful for any anti-coag related questions is what I've found. Other questions? This will all make a lot more sense when you actually are able to log in and, you know, do it yourself too. But I think we just wanted to show you kind of the ins and outs of EPIC and what you can use it for. Just knowing that there's going to be so much information that, yes, it's good to recognize that it's there, but it's probably not going to impact you specifically as a pharmacist. So being able to recognize what things are important for you to get through your patient list that day versus what you just want to read about for pleasure later on. Yeah. I don't know. Sometimes there's some interesting patients, so. Yeah. All right.